Hi, my name's Allie. I'm a member of the VCU class of 2024, and I did my family medicine rotation in January 2023 with Dra Germosén in Santiago, Dominican Republic. And I'm going to tell you a little bit about my experience there. One of the most valuable things of this experience is the amount of very unique learning that you get. You really get a good understanding of the cultural, linguistic, and medical background of all of these patients, and it's information that is very valuable when you get back to the US so that you can bring it to better understand and better take care of your patients here in the US. One of the other great things about this rotation is that there's a lot of diversity in the patients that you see. I saw everything from 2-week-olds to 98-year-olds. You see pregnant patients, you see patients with chronic conditions, you see patients with acute conditions. And because of the setting that it's in, you do get to do a lot of hands-on things like placing IVs, suturing, suture removal, pap smears, and listening to fetal heart tones, all sorts of stuff. I can honestly say that there was really never a day that I was bored in clinic. You also get a lot of great teaching from the doctors there, as well as from the nursing staff and from the clinical staff. And you learn not only about the individual patient in front of you, but also about sort of their background and what goes into why the patient is here. Another great thing about it is that you get experience with other medical students as well. The Pucamaima students also come into the clinic, and you get to sort of work with them and see what their education looks like and get to see how different and for the most part similar our educational experiences are, and I formed some really great friendships through that as well. Additionally, you get a lot of independence in the clinic. I really felt like these were my patients. Like I wasn't, on the sidelines. I was really there. I was providing a lot of the care. I was really, I felt like the doctor a lot of the time, which was really great. And I got to learn a lot from Dr. Germosén and from her pearls and her teaching along the way as well. And then finally, I think that it's very valuable to get this sort of low resource setting education and learning how to treat patients at the lowest cost possible in a way that, again, I don't think we really get that, that same teaching here as much. So yeah, I think there's a lot of great learning opportunities and a lot of wonderful, wonderful, wonderful people there. And, things that you learn that are tangible and intangible that I think are very, very unique to this rotation. So I would highly recommend to any third-year medical student who speaks Spanish to take advantage of this rotation, because I think it really is the highlight of my M3 year.